Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the pneumonia types treatment. Pneumonia is a common respiratory disease occurs in infants as well as children. Pneumonia may be classified according to the anatomical involvement of the lung tissue or the pathogen responsible for the pneumonia. Clinically, two types of pneumonia are differentiated. Lobar pneumonia affects one or more lobes of the lung. Bronchopneumonia lobular involves patchy areas of the lung and occurs mostly in infants and young children. Occasional pneumonitis, the alveoli or intestinal tissues between them may be infected. It is usually revealed by radiography. Aspiration pneumonia. It may occur in a variety of circumstances like newborn, amniotic fluid, drowsing, vomiting, foreign bodies, inhalation of chemicals, vapors, hydrocarbons, kerosene, etc. The organisms responsible for pneumonia are bacteria, pneumococcus, streptococcus, staphylococcus, H. influenzae, freelanders and Mycobacterium tuberculosis. Virus, influenza virus, psittacosis, smallpox, chickenpox, measles and other viruses. Fungi, blastomycosis, cryptococcosis and histoplasmosis, etc. Clinical features. Irrespective of the type of organism, the features are common. Onset is sudden, temperature rises 102 to 104 Fahrenheit. Cough, dyspnea. Ala nasi dilate with each breath. Tachypnea, respiration rate 40 to 80 per minute. Tachycardia, pain in the chest, grunting, lower intercostal recession, distension of abdomen. Neurological symptoms like meningism and convulsions may occur. Rusty sputum may be observed in older children. There may be vomiting, anorexia and refusal of feeds. Diagnosis. Breath sounds typical of lobar or bronchopneumonia may be heard. The white cell count is elevated. Now we see the features of specific types. Lobar pneumonia. It is caused by pneumococcus and seen in children between the ages of 5 to 15 years. In infants, it may show nervous irritation causing fits, vomiting and meningeal irritation. A grunt is often noted at the commencement of the expiration. Pain in the chest may be present in older children. Occasionally, it may be referred to the abdomen or shoulder. Central pneumonia, some variation in the disease of upper lobe, where central nervous system signs and symptoms may dominate with practically no clinical signs in the chest. On examination, impaired percussion note over the involved lobe, tubular breath sounds and coarse crepitations. X-ray reveals a diffuse opacity of the involved lobe. Bronchopneumonia. The onset is slow and occurs in younger children. Predisposing factors include pertussis, measles, malnutrition and acute gastroenteritis. Clinical features. These take the form of a generalized infection in infants with hardly any sign in the lungs. In older children, it occurs as a complication of the diseases like measles, etc. There is elevation of the temperature, tachypnea, cough, etc. Clinical examination reveals retraction of the lower chest and intercostals, patchy areas of dullness and crepitations, tubular breath sounds on auscultation. X-ray reveals patchy areas of consolidation, complications, diarrhea, sinus thrombosis and emphysema secondary to bronchopneumonia. Staphylococcal pneumonia. It is common in all ages of children but specific in infants. Sudden onset, progressive in nature, causing destruction of lung tissue, causing multiple abscesses. May lead to empyema or pneumothorax or cavity formation and may disappear. Friedlander's pneumonia. It is caused by Klebsiella pneumoniae. Sudden onset, high fever, pneumonia, cyanosis and severe toxemia. Diagnosis. Diagnosis is made by identification of gram-negative encapsulated bacteria in the smear of sputum and isolation of organism in blood and sputum culture. Intensive treatment is necessary to save the life. Virus pneumonia. The clinical picture is different. In primary atypical pneumonia, there is a paucity of clinical signs with a large consolidation in X-ray. Influenza pneumonia produces severe symptoms like dyspnea, cyanosis and crepitations over both fields. Aspiration pneumonia. It is usually accidental and present with high temperature, dyspnea, cough, shows signs of bronchitis and patchy consolidation. Treatment. Organism may be multiple, so treatment aims at mixed bacterial pneumonia along with a high dose of corticosteroids. If possible, sensitivity tests may help accurate treatment. Treatment. As a whole, general measures: bed rest, oxygen for dyspnea, restlessness and cyanosis, adequate amount of fluids, attention to diet and nursing care. Symptomatic measures: cough, sedatives, phenobarbital and chloral hydrate to allay restlessness or to provide sleep. Secretions. Removal of secretions and infected materials from the tracheobronchial tree by suction is life-saving in infants. Digitalis used of heart failure and transfusion of packed cells given in case of severe anemia. Aspiration of pleura and closed intercostal drainage are indicated in case of pneumothorax, pleural effusion or empyema. Specific therapy. It is directed towards the causative organism by appropriate antibiotics depending upon the pharyngeal swab and blood culture. Initially, penicillin is administered. Physiotherapy by way of breathing exercises is helpful for recovery. That is all about the pneumonia diagnosis and treatment, and in the next video I will discuss about some other disease. Thank you.